and action. Okay, Ed tonight had a question about why should I see a psychologist? And it's a great question. I will always have videos about DrRic tutorial anxiety, DrRic tutorial 478 breath, DrRic mindful practice, relaxation practice. I've put many of them on. You just do a search and you'll see, but truthfully, I try to soften the word anxiety, soften the word behavioral therapy, soften the word psychologist, because I think most of my patients will be like, oh, I don't want to go there. It seems to be a reflex built-in reaction now that means I'm broken. And so I try to really make it easier to a softer landing, I guess. That's why I say mindful practice, or I say breath exercise, because it's important. I might even deconstruct the word anxiety and say, all right, I just want you to relax, get acupuncture to calm down. This is a great point for relaxing, calming down, Li4 it's called in Chinese meridia. But I do that because I don't want to, number one, I want to empower patients, but number two, I don't want you to feel bad. As my patients, I don't want you to feel bad that there's a disease process going. I mean, I'll call it as best as I can with a black and white name, but it still comes down to trying to carve out a personalized practice. So what I usually do with my psychologist is, if I have tried a couple things with my patients on developing a form of mindfulness, some way to turn off that anxiety or that panic attack. I mean, we all have medicines. I should say, I don't have any medicines. I think I tried Xanax once and it gave me all the side effects. But we usually, as doctors, prescribe Xanax for panic attack, because panic attack is so disabling that we want patients to have a Band-Aid. We want to be able to drive home, get through the plane flight, get through the speech you're giving to 1,000 people, and then go on with life. But sometimes the time period at that circumstance or building up to that circumstance, life is terrible. Can't eat, can't drink, can't sleep, and that's not healthy. So the Band-Aid is there. Medicines, and that's a beautiful thing about prescription medicines, is they're so powerful. They're highly addictive, behaviorally addictive, but they are powerful, so they do work as very strong Band-Aids. I always try to get, as much as possible, some herbal form. I love ashwagandha. I think that magnesium is excellent. This is magnesium L-threonate. Sometimes, this is what I used to use before I would give lectures at Whole Foods. Passion flower. Drop this in the mouth right before my lectures. Great response. There's always essential oils. You can turn on the aromatherapy part of your brain. The olfactory senses can stimulate the brain to calming noise. I gave anxiety hacks video out there, and I talked about calming down the 5 senses to help with that anxiety response. The bottom line is that you do have, if you suffer from anxiety, whether it's genetic or it's learned, acquired, you do have this abnormal reaction to what might be a normal situation. And we can always use all these hacks that I just talked about, but if you get to the point where you accelerate way too fast into a panic, I mean, what are you going to do? You're going to pull over on the highway and freak out, pass out because you're hyperventilating too much, or you have blood pressure that just spikes and you have a stroke. We don't want that. So doing a breath exercise like I suggest at the time that you're having a panic attack is probably not going to save you. It's probably going to be useless, truthfully. So that's why it's important to have a coach of sorts in the behavioral health field, because I'm pretty good at what I do, and I think I have a plethora of different things to apply, whether it's Western medicine, herbal medicine, acupuncture, Chinese medicine, Ayurveda, yoga, breath work. I think I can go and come up with a couple different solutions or different possibilities. If one doesn't work, I'll go the other way. If that doesn't want to work, then we'll go this way. So that's nice, because when you go to a psychologist, we're talking about somebody who went into college, went to post-grad, got a doctorate. So these guys spend a lot of time. And the psychologist I use, and she's in 2 of my videos, Dr. Nicole Parmalee, fantastic. Not only does she teach mindful practice and yoga, she's also a board-certified psychologist. So she has different tools that she can rely on to give to you, my patients, In case one tool doesn't work, you've tried it, does not for you, you can try something else. But if you have a coach that's very gifted and has a plethora of different things to give you as far as suggestions or apply, design, I guess, then you know you have a higher success rate. So if you go to somebody, and I know a lot of good counselors as well, but if you go to somebody that's like your confidant, a best friend, that went through the same problem but has their way of finding a solution, that one way, it might work for you, but what happens if you try the way that your friend went through and got his salvation from, but it doesn't work for you? It's like, what do you do now? That same person will push the same thing. So that's why it's really important to go to a professional. And that's why I like psychologists. They can also give me some feedback, because many times if you have an anxiety issue, there might be a hidden comorbidity, like a personality disorder, an attention deficit disorder. Maybe there's some hidden problem that you didn't realize when you were a child. But having somebody kind of ask you the right questions and then pick and choose and develop a picture of you, that snapshot is so important. When you come to see me for the first time, I usually spend a little bit of time, more than the usual primary care doctor, to develop a snapshot. I develop a picture of you, and then usually it's reverse engineering, as I always say, reverse engineer back to where the problem first started, and hopefully you can find the solution. But if you have somebody that spends the time, is well versed with different modalities to try or attempt, and is also well versed with not only the Western medicine approach, but the Eastern medicine approach, the natural medicine approach, and that's in a psychologist, then you have a higher chance of success rate. My biggest thing for my patients is we got to make everybody live and survive, being very active and contributing to society up until the age of 90. If we have, life until you're 103, but you're on a ventilator and you're a vegetable, what kind of life is that? That's just a burden for the rest of the family. So if you look at the blue zones, where Buettner talked about ages of 103 or around that age being very high with productivity and involvement in the family around several areas of the world, you'll see that those areas of the world always had some form of relaxation practice, some form of activity, some form of family bonding, and usually a whole food plant-based diet. So if we can emulate that, that'd be great, but not all of us can do that. And for those of us who are deep in the crap and it's too hard to get back or trace your way back, then it would be important to use the prescription, but it's also just as important not to mess around with 4-7-8 breath exercise, but to jump to the next highest level. If I'm going to use big medicines, then we got to go with cognitive behavioral therapy, EMDR, these other things that only the psychologist will be trained with. So hopefully this gives you a little bit of information on why I value my psychology friends. Worst case scenario, you can check out Psychology Today. It's a magazine that the psychologists all put their names in, and if you put the search in for your area, it'll give you a long list of providers in the area. You can search out their bios. I always say look for somebody that's trained in mindful practice in their bio. That'll be somebody well versed. There's also John Kabat-Zinn came up with this idea about mindfulness-based stress reduction. I think it's a great added benefit if you can find somebody who teaches that. It's hard to find. I think we have a couple of people downtown Chicago, and local in the area, there's a few. But if you can take advantage of that, that's great. If you can find a savior and somebody of a coach that can keep eyes on you and keep me informed, and we can work together, in addition to a activity coach, will you get you set for surviving without any big hiccups in life. So hopefully this helps. Please subscribe to me for further Dr. Rick